Hello, hello, hello. Good afternoon, Facebook. Thank you so much for joining me, Victoria Creppy here, woman of influence. We're going to have a wonderful, wonderful show today. If you are following us, you could see that the whole of this month we're talking about anything about health. Taking care of your body, exercising, everything. How blood pressure, how to deal with it, and all those things. So that's what we've been talking about the whole of this month. If you have missed a couple of the shows, please go back and listen to it because it's going to really, really help you. The first one we talk about blood pressure, we talk about diabetes, all those things, and how to really deal with those things. And I think the second week was fitness. So anything about fitness, um, exercising, what exercise does to your body, your mind, and everything is really, really good. So please go back and listen to it. I think it will be a blessing. Just continue to share the video too. But thank you so much for joining me this afternoon. Today we are talking about mental health. And it's something that it's just very interesting how we find ourselves in this generation that we live in, that you hear people committing suicide almost like every day. Okay, so what is mental health? How can we help people who are dealing with that? Because sometimes we even have people, Christians, pastors are committing suicide. What can we do to help people when they find themselves in having an issue with their mental? So that's what we are going to talk about now. My sisters are back here with me. They are doctors, so they know what they are talking about. So we're going to listen from them. And please, if you have any question, if you know anybody that has been struggling with it, sometimes it's very interesting, when it comes to Christendom, that we think is something that is shame. We don't talk about it. But I think the time have come for us to talk about it and deal with it. So mental health, is it a sin? Is it something? Why can't we talk about it? So I want to use this platform, talk about it and see what God can do to help us. So please continue to share the video, tag somebody to come in. And thank you so much for joining me again. So thank you so much. Good morning, good morning.
Good morning.
Good morning, sis. Good morning, good morning. So here we are, mental health. I think the 10th of this month, if I'm not mistaken, was National Mental Health Day. The 10th of this month, because I saw it on social media. They say that call people, call your friends and make sure check up on them, make sure they are good and all those things. And it's very, very interesting, topic, especially when it comes to the church setting.
Yes.
How we see mental health is very, very interesting. So I really want us to take our time and break it down, so that everybody will understand that. I don't think it's a shame, it's a sin. I personally see that you having a headache or having a stomach issue, if you can go and see your doctor for that, then if here is also not working right, there's no shame about it. But we find it very difficult to deal with it. Okay, so I want us to talk about it. But before then, can you please introduce yourself again to the viewers? Let them know who you are, so they will know that you are talking from your professor.
That's problem.
Yeah, so please go ahead and introduce yourself.
So welcome again. I'm very grateful to be here again on this platform, Dr. Victoria.
Thank you.
So my name is Dr. Maxine Owusu. I am an emergency medicine doctor here in Georgia. So thank you guys for having me.
Madam.
They know you by now.
I know.
Yeah, I mean, you are part of me now.
Hello, everyone. Of course, my name is Pastor Nana, and I'm more into women's health. I deal with a lot of women across their lifespan, and mental health. It's something that I see a lot or deal with, and so I believe it's time for us to actually talk about it.
Wow.
It's time for the church to really talk about
Talk
it,
about it.
so that we
Okay.
can find ways to deal with it, because I believe that God has made the provision,
Mm.
because when he died 2,000 years ago,
Mm.
he released us to have healing in every area,
Yes.
because his word says that by his stripes we were healed,
That's it.
and
That's
he took
it.
those stripes, so that
Mm.
means that there is a solution
Mm.
to every sickness or every issue or every disorder that is on this earth.
Okay.
And
Awesome.
so I believe that God is going to release some people today. Amen.
Today, amen. We thank God for that. So, Doug, I will start with you. So,
Sure.
when we talk about mental health, what is mental health?
Okay.
Yes.
So when we talk about mental health, we're talking about emotional states, basically, a person's condition where there's a balance of emotional well-being, psychological well-being,
Okay.
mental well-being. So being whole, when we talk about mental health.
Okay.
So the opposite of, that would be mental illness.
Okay.
So people who have mental illness, there is an imbalance when it comes to their emotional state of well-being,
Okay.
their psychological state of well-being.
Mhm.
So their thoughts, their practices, it's affected.
Okay.
So there's imbalances, and there's a lot of things that can contribute
To-
to mental illness, and that
Wow.
can contribute to this. So that's what we'll be discussing
Okay.
more today
Into it.
about
Okay.
what causes mental illness.
Illness. Okay.
Mhm.
Awesome. So can we go into the cause? I think
Sure.
it will help. Oh, sis, do you have anything to talk about when it comes to mental health before we talk about the causes?
I just believe is the way that mental illness is when our thinking, our behavior, or our mood is altered negatively.
Okay. Okay.
When the way we usually think, we're not thinking the same way
Same
anymore,
way.
or the
Okay.
way we usually behave, we're not behaving like
The
that
same.
anymore
Mhm.
because of something that has happened in our lives.
Okay. Okay, because this is, and it's good that we're going to talk about the causes, because I think that sometimes, and as I said, I feel like if we are having mental, issue, mental illness, it's the same as me having maybe a gastro problem, or me having a blood pressure or something like that.
Yes.
It's easy to say that, oh, I have a blood pressure. It's easy to say I have a gastro issue. But it's not easy to say I have mental illness. Then all eyes are open, like, okay, what are you going to do next? Okay? So I want us to let's talk about the differences. Let's talk about the differences of mental illness before we even talk about the cause.
Can I say
Yeah.
something before she talks about that?
Yeah.
I believe it's a stigma that has been
Yeah.
attached to mental illness
Yeah.
as opposed to having high blood pressure or
Okay.
diabetes.
Mm-hmm.
Because when you have high blood pressure or diabetes, you can go to the doctor and get treated for it.
Yeah.
But because there's a certain type of stigma attached to mental health, it can also be cultural.
Yeah.
You know what I mean? Depending on
Yeah.
where depending on the type of the world
You
come from,
Yeah.
they see mental illness as something bad, and so they begin to tag the person or the whole family as they have something that is uncalled for.
Okay.
You know what I mean?
Yeah.
And so when people have a mental problem, they find it difficult to come out and let somebody else know.
Yeah.
Because people feel like if they talk about it, then they will be tagged.
Okay.
For example, in Ghana, when a man or a woman has or in Africa, a man or woman has mental illness, it's hard for them to even find a spouse.
Oh, yeah,
Because
it's a
everybody
victim, yeah.
is going to say, oh, this family, they have this mental problem, and if you marry them, you're bringing an issue
curse.
or a curse or whatever
Yeah.
on you. So there's a tag,
Okay. Yeah.
and instead of us finding solutions to it, we tag the person and we make the person the disease, and we don't separate the person from the disease. Just like how we'll separate somebody from high blood pressure
Okay.
and say, oh, this person has high blood pressure and we're going to get treatment for it. They will call you mental, or
Mental,
high blood.
yeah,
They'll call
yeah.
you as the disease,
Disease.
and they don't separate you
that.
from from the disease.
Disease.
So
Oh, okay.
I believe the stigma that is attached to it.
Wow. Please, if you are watching us, thank you so much for joining us this morning. We are talking about mental health, okay? Mental sickness. You know, everything that is really causing people to have suicide. We have youth doing it, the school. I mean, it's just overwhelming. Pastors, everywhere you pass, this thing is happening. What is causing it? What is causing people taking their life? What is causing people to behave like that? So we are talking about mental illness. Is there anything we can do to help these people? So please continue to share the video, tag somebody to come in, and I think it's going to be a blessing to them. So Doc, what are some of the differences? Because I've noticed that there are some that is really, you know, and there are some too you won't even notice.
Yeah.
You know, they bipolars and all those things, you won't really notice, you know, and there are some that are out there. So what are the differences?
Sure.
Yeah.
So mental illness is, I would say, like an umbrella, right? And
Okay.
under the umbrella, there's different types of mental illness.
Okay.
The most common is depression.
Oh, so depression is mental.
Depression is under the umbrella of mental illness.
Oh, okay.
So depression, anxiety,
Wow.
and bipolar.
Okay.
Those are the most common. But
Yeah.
there's also schizophrenia. There's bipolar. They actually have also personality disorders, which are also under mental illness, which is your personality, but some things are very similar to that.
Okay.
So I would want to focus more on the most common, which would be depression. If we can talk about depression, anxiety, and we'll also talk about bipolar.
Wow.
Yes.
I can chip in on the
Yeah.
personality.
The
So
personality.
yeah. So first,
Yeah.
with depression. So there's a difference when is like, you know, you're sad, you know, because we
Okay.
all have feelings.
Yes.
Something happens, you can be sad, or sometimes people use it like I feel depressed. But when we say depression or having a diagnosis of major depressive disorder, it's basically a condition where you have a persistent feeling of unworthiness, a
Wow.
persistent feeling of you just have lack of interest. So you don't want to do the things that you used to do. You don't want to even take a shower, get dressed.
my God.
Maybe simple things that you used to find interest in reading or talking with your friends or family. So this is persistent. You know, this mind thoughts of feeling you're unworthy, that you can't do anything, that you're not good enough. So persistent enough that it's affecting your daily function.
Yeah. Yeah.
So you can't even go to work anymore. You can't, you know, just simple things, even things that you would to do, take a walk in the park. You can't even do any of these things. So, so that is the definition: having persistent thoughts of that affects your functionality. Is depression, and they actually say for 2 weeks is major depressive disorder. If you're having this persistent for 2 weeks, is actually having depression. Yes.
So if you are having that behavior or depression for 2 weeks,
yes, that is affecting your functional life, daily living of activity for 2 weeks.
Okay.
For example, you're used to getting up in the morning and going to work. You get up, you brush your teeth, you clean yourself, you get ready for work, and you go to work and do your normal daily activities.
Okay.
You get up, you don't want to get up from bed.
Okay.
There are people that will stay in bed for a whole week and not even get up, wash your face, take a shower, brush your teeth, not eat,
Wow.
not do the normal daily activities that they were doing or they were used to doing. They just don't want to do them anymore.
Wow.
And you ask them why, they just don't want to do it.
Yeah.
There's no reason. I don't want to do it.
Okay.
So it's affecting your daily life, your daily living, your daily activity.
Okay.
You know, so if you do have, for example, if you're a mother or a wife, and you do have this and you don't want to do anything, it is going to be a ripple effect.
Yes.
It's going to affect the whole family.
Wow. And bipolar too. So I personally I've seen people, you know, that are bipolar, and it's a very, very interesting thing.
Yes.
Because one time they are all that, they are nice, they are dark, and another time they turn to something else.
Yes.
So how serious is that?
Yeah, so bipolar is very serious. So the definition of bipolar is basically mood swings,
Okay.
where someone will be at a low. So with bipolar, you can be depressed
Okay.
at one point, and then also then become at a high, which is, they say, mania. So you're manic. You're kind of, very
High.
outrageous. You're doing things like some people may like in one time maybe cash out your bank account.
Wow.
And just go
And spend everything.
spend everything. So just irrational behavior,
Mhm.
and it switches.
Okay.
So that more so is like bipolar. But then some people have personality disorder. So it might be a personality where you can have mood swings, but it's not as drastic as actually having bipolar, where you're having these switches.
Yes.
So there is a
So,
difference
for
when it
example,
comes
with
to-
bipolar, the person will stay in front of their computer for like 3 days and not sleep.
Yes.
Hmm?
Yes.
They won't
So
sleep
that's
for
the
3
manic
days
episode.
or 4
Okay.
days,
Mhm.
and they're just working, and there's nothing that's in your body that's even telling them that you're tired and
You need to go to sleep.
Sleep.
They have-
Wow.
Yeah.
That's the manic part, which is
Okay.
the high. I call it the high part.
Yeah. Okay.
And then the low part is when you're depressed. So you will have someone that will have both, and it will alternate.
Okay.
Back and forth.
It will just alternate back. That's why it's called bipolar. It's
Okay.
like two types of.
Of the opposite ends.
Oh.
Kind of like a negative and a positive of
Positive. Okay,
electricity. Yeah,
basic.
they're just, yes. Back and
Wow,
forth. Yeah.
that's very interesting. And what is the personality disorder too? Because that is very interesting. I can just imagine, walking around with such a person.
Yeah.
What do they normally do? What is the behavior?
So it's like irrational, rigid way of thinking.
Okay.
Like you perceiving. For example, some people that have personality disorder think that they may think that they are the best and nobody else matters.
Oh. Okay.
That everything that they do is the best.
Okay.
They're like the best person ever happened.
Wow. Okay.
And they just don't think. So everything that they do, they're just thinking about themselves only.
So
Even when they're wrong, they don't even see that they're wrong. They're right.
wow. So they are always right. They are always the best. How can you work with such a person?
Yeah.
You can't even correct them.
Yeah.
Because
So
they
with-
think,
So with
Yeah.
personality disorders, there's actually 10 types of personality disorders.
So
And
that's
they,
just one
they
of them.
group it. So what she was talking about, someone who is narcissistic,
yeah.
meaning that it's all about them. They always think they're right. You can't tell them anything. It's just about me. It's about me. That's the type of personality disorder that they have.
Okay.
But then there are also people who have, there's a lot of it, so probably it would take too much
Yeah,
time to go through it.
No, let's go
Okay.
through. So at least our viewers will understand, because it's something that's really going on. And
Yeah.
me personally, as a pastor, dealing with a lot of people,
Mhm.
you see all these things, and I think that sometimes I think that pastors need to be trained
Mhm.
about this bipolar and personality thing. You understand? Because sometimes when people come around and they are behaving like that, and you don't take care, because as a pastor there's a thin line, so you don't take care. You even think it's you who is doing something wrong.
Yeah.
You understand? And you haven't done anything wrong. It's just somebody going through the personality differences and the bipolars and everything. And you might think that you are doing something wrong, which it doesn't have anything to do with it. So maybe we don't have to do all, but let's
Some of the
bring
main
some of the
types,
main
sure.
types, up, and let's see. Yeah.
Yeah, I think one of them is similar. It's called borderline personality
Okay.
disorder, which is 1 minute they'll like you, they'll
Yeah.
say like, oh, I love you, I love your hair, I love this about you, I love this, and then the next minute they hate you.
Oh my God.
Yes.
Okay.
So it's kind of similar to. It's not the same thing as bipolar, but it's a
Okay.
personality disorder where the same person, they can just switch on you.
Yeah.
So people like that, you have to be very careful. You
Yeah,
have to
because
get very comfortable with them,
With them.
and you might not, you didn't do anything to them, but then all of a sudden they don't like you anymore.
Oh my God.
So that some people have that.
Okay.
And then there's one that's called histrionic personality disorder. That personality disorder is they're maybe always tearful. They're always crying. As some of these personalities, as you
Wow.
think about it, you actually think of certain people that you.
I
come into
know.
contact with.
I'm just going through my
Yes.
mind. Everything they are crying.
Yes, very tearful about everything, a little bit dramatic about certain things.
Okay.
So they have personality disorders like that.
Oh my
And
God.
I can also-
Please, if you have a question, we have a question already, I know. Can we take the question, please, before?
Sure.
Yes.
It says, I've realized that when stating to a counselor / pastor friend about what's going on in one's life, there's this tendency to not believe or dumb down what someone is going through, thus causing the individual to feel like he or she is crazy or stipulating that whatever is going on isn't. Have any of you ever seen or heard this experience before?
Okay.
Yeah, I think sometimes, especially culturally, I've seen that among different African cultures or African American, Caribbean cultures.
Yeah.
There's this expectation that we're supposed to be so strong
Yeah.
that no one can talk about how they're feeling.
Okay.
And even in families, when you may be feeling depressed, you bring that up, and it's like,
Why are you depressed?
yeah, it's like, why are you depressed? You have
You
money,
have
we have
everything.
money, we have food, I have shelter. And so they kind of dumb down your feelings, like you shouldn't be depressed. And because of that, the person can't really open up. Whether it's a child trying to talk to their parents about maybe how they're feeling, they may feel even shameful about it, or even, it's like, I provide for you, so why should you be depressed? And make the person feel bad about even wanting to talk to their parents about, what they're going
Yeah.
on. So I think we have to be very careful about that, because then sometimes your kids may not want to talk to you about anything anymore. They may go talk to someone else or the wrong people because they feel like they can't come to talk to you because you'll be like, as Africans, you shouldn't feel this way, or,
Strong.
yes. And so, or even in the church, not feeling like you can talk to your pastor or elders about these things because you shouldn't feel depressed if you're a Christian.
Yeah.
And I don't think
that is the norm.
yeah.
I mean, yeah.
So we need to talk more about
Or if you're
that.
feeling fearful about something, it's okay to say you're fearful about it, so that we can talk about why are you fearful?
Okay.
What do you think is causing you to be fearful? So we can deal with it and get to the bottom of it. But you will see a pastor saying, God has not given you the spirit of fear. Why are you fearing? And we dismiss the underlying issue why the person is feeling fearful.
Yeah. But that is what the Bible says anyway.
It's true.
Yeah.
And so if we can, dig at the bottom of it and find out why you're fearful.
Okay.
You know what I'm saying? Like, for example, you have a young lady in the church who has met someone, and now they're being fearful about committing
Okay.
because of a history or in the past they had an issue like that.
Okay.
That is something that needs to be dealt with, so that she doesn't carry that into the new relationship. Because this new relationship may be the lasting relationship, may be the relationship that will lead into a lasting relationship. But because of that barrier of fear that she's discussing, or she may not even say, but you may see it by her actions, by the way she's behaving, that there's something wrong. And as people of God, we need to be able to be vigilant and observant, to be able to see what's happening with people. If they're behaving differently from the way they usually behave, we need to call them out and say, is everything okay? Because I've noticed that you haven't been yourself. Or if they're dressing weird or funny, you know what I'm saying? And they're not used to dressing that way.
Okay.
You know what I mean? It's something that we need to, I've noticed that you've become very snappy lately. Everything that you hear or everything you go off and you get snappy. Is everything okay? Do you want to talk? And if you're not the right person that they want to talk to, find somebody in the church that they're comfortable with that can get things out of them so that it can be dealt with.
Oh, okay. I hope we have answered your question. Can we continue with the type of the personality?
So I want to talk about one. There are people, especially, and this happens a lot with the people in the church.
Okay.
People who are in the church, they tend to be very suspicious. That's like the paranoia.
Okay.
They tend to be very suspicious of everything.
Everything.
You bring them food and they're like, maybe they put something in the food. or you give them a gift of maybe like money and they don't even want to spend it because that's, or you give them a gift of clothing and they're like, oh, if I wear this then they'll put some voodoo on me, or you know what I mean, like they're just very suspicious of everybody. You know, I mean, don't get me wrong, there are people that are out there that are evil, but not everybody is evil. But this, right, you need discernment to know who is who. But when people have this type of disorder, they're suspicious of everybody, even the pastor.
Everyone is out to get them.
They feel like everybody's out to get them. And that's not normal.
Yeah, because I had one situation now, and it's very, very interesting. The first thing they will post on their Facebook is, you think you can get me? I'm coming, I'm fasting, and I will come and get you. And I'm like, nobody's coming to get you. You know, so these things like this, sometimes it's very hard, and you are trying to advise, and they think they are fine. You know, they don't need any medicine. They don't need anybody. Oh no, I'm fine. There's nothing wrong with me. You know, it's my family who think I'm sick, but I'm not sick. But the way you are behaving is really not, you know, the best. And sometimes it's very hard, you know, helping them because they think there's nothing wrong with them. All right. So let's continue with that.
So another one is called avoidant personality disorder. So those are people with personality disorders that they want to avoid every situation. They don't want to talk about anything. They don't want to. They want to just kind of stick to themselves. And that also it's a disorder because as human beings we need each other. We need to communicate. You can't just whenever there's any issue, you can't just avoid it. You have to be able to deal with that situation. So there are some people that they just don't want to deal with anything, and of course that would impact their life. How can you have a job if you're a person? How can you have any sort of relationship? So there are people like that and you may sense that whether it's in church and your family members, people with some of these personality disorders, you can't really get through to them because they would avoid every situation.
Wow. Oh, okay. But do you have more to add to me?
One more is the dependent. They have, which I think, dependent personality disorder. So those are people who they can't do anything on their own. They need to be dependent on somebody. So, but because of that, sometimes you can see, especially females that may get into wrong relationships. Just because they can't do anything, they need to depend on someone. They may be in with the wrong person and become an abusive relationship, but it's because they feel like I need you. They need someone to do everything for them at all times.
They can't just be by themselves.
Yeah, they can't be.
And I think those are the people that even when they are in abusive relationship, they think that if I leave, what can I do? I can't do anything. Their mind is telling them you can't take care of yourself. So somebody's abusing them and they are still there because they think they cannot do anything without the person. Wow. Okay, that's very interesting. So what caused these things? What caused mental illness?
So mental illness, the causes is multifactorial, meaning that there's a lot of numerous reasons that can cause this. But some of the things is biological, so chemical. So there are chemical imbalances in our brain, chemical neurotransmitters. So if it's imbalanced, so for example, one is called serotonin. It's a very common neurotransmitter. So if serotonin basically...
And those affect your mood.
Yes, it helps with your mood and behavior. So I can actually give you the specific, so it regulates your sleep, appetite, mood, and it stops pain. So if in depression, people have low levels of this chemical called serotonin. So if you have low levels, then you'll be always down, you don't want to eat, you're sleeping too much. So you don't want to do anything. You feel unworthy because your serotonin levels are low. Another common one is dopamine. So dopamine is a chemical that basically makes you feel high. It helps regulate our reward system as human beings. Like why you get happy. You get happy when you're doing things, maybe when you're feel good. It's because of a dopamine. Dopamine makes you feel good when you're doing things that make you feel good. Or even when you're eating, you feel happy because of our dopamine.
Okay.
So in depression, dopamine is low. And some people, they've noticed that the dopamine chemical is low in people with depression. Or in anxiety, it would be high. That's why they're always jittery. They can't do anything.
Right.
So these are some chemical reasons why it can contribute to mental illness. There also are hormonal reasons. There are hormones, where Pastor Nana will go more into that about why, if you have imbalances, it can cause these things. I'm not sure if you want to
So,
go.
yeah.
Yeah.
So, for example, our hormones, we have estrogen, which is a female dominant hormone. That is what is more abundant in females.
Okay.
And then we also have testosterone, which is more abundant in males. Even though males have estrogen and females also have testosterone, one is higher in one sex than the other.
Okay.
And we also have progesterone. Okay. So, for example, when these hormones are directly also related to those chemicals that you talk about, the serotonin. And so when your hormones, which is the estrogen, the testosterone, for example, if estrogen is also the serotonin and the dopamine.
Okay. But with all these chemicals and hormones and everything, if somebody is low, let me say if it's low, can it be refill or can it be?
Yeah. So many a times, not all mental health doctors or not all psychiatrists do it. Most of the time, they take care of the symptoms. Meaning, if you go in and they see that you've been sleeping for the past 2 weeks, you have no interest in doing anything, and they do their diagnosis, they will diagnose you with depression. And what they're doing is they're just managing your symptoms. They're going to give you the medications to fix it, right?
Those
But-
medications those specifically go towards the chemicals, because they give you medications that are targeting the serotonin. Those antidepressants are going to try to increase
it so that you can come back to your balance, your normal level. However, there are also some doctors out there, when you go to them and you tell them, you know what, I've been having feelings of fear or anxiety, or I don't have interest in doing the things. Sometimes I have patients come into my office and they will cry for no reason.
Wow.
Or I don't have any interest in doing the things I used to do, and they'll give you a whole bunch of reasons. And if the doctor or the provider is very knowledgeable, they will say, let's do your hormonal level. Let's see what's going on. For
Okay.
example, if a woman is going through menopause or something, she may have feelings of, I'm not myself anymore.
Okay. Okay.
Something is wrong with my body or whatever. And so I don't like to do the things I want to do anymore. So in a situation like that, a knowledgeable doctor, and that is what we spoke about the other time, it's important that you find somebody that knows what they're doing.
Okay.
You know, will say, let's do your hormonal level. And if they see that the hormonal, there's something wrong with your hormones, or there's a hormonal level issue, that can be fixed.
Wow. Okay.
And once that is fixed, that will help bring everything else back to normal.
Okay. Wow.
So there's definitely a hormonal component.
Component to it. Okay, so thank you so much for joining us this morning. If you are watching us, we are talking about mental health, everything concerning mental health. We are talking about, the different personality, depression. I didn't know depression is that serious. So depression, bipolar. We are talking about all those things. We are talking about the causes of mental health. Okay, and the chemicals and those things. These are doctors talking here, so they are giving you some of the things that that can cause it. Personally, I think that we have to see mental illness and mental health as any other disease. The way we go to the doctors and take care when the doctors say we have cancer and we have to do chemo, and we do all those things just to get well. I think that is the same thing we have to approach when it comes to mental health. And rather unfortunate, especially where I'm coming from, is a whole different story when you tell somebody that you have mental illness. But I pray that God will help us. And I love when Pastor Nana says that when Jesus took our diseases and sicknesses, all these things was part of it. So what provision have God done? What provision have Jesus provided for us as children of God to live a better life? Okay, and I think that doctors are not evils, they are not devils. God have given them to us, you know, to help us when we need help. All right, so please, if you are watching and you have anybody that is going through any mental challenge, please seek help. Okay, it's better to seek help than it being too late. It's really better to seek help than taking your life. If you're a Christian and you take your life, I can guarantee you are not going to heaven. So if any devil is speaking into your ears that it's better to take your life, whatever you are going to face is worse than whatever you are facing now, because you're going to hell. You are not going to heaven by taking your own life. There is nowhere in the Bible that says that commit suicide and come to heaven. So if you are thinking about that, please seek help before it's too late. All right, but thank you so much for joining us. Share the video with somebody, and we will continue talking about this thing. So what are some of the types? I think we are talking about the types already. So what typically can we do to help people with
We had more causes.
Oh, we have more causes.
So,
Okay.
So we talked about the chemical and the hormonal, but then also environmental can cause some environmental factors. So some life-altering events.
Okay.
So like someone may go through divorce. Or
Wow.
someone who might have been in the military and they saw a lot of bad things, you know, killing, so they have post-traumatic stress disorder. Someone that might have been raped or assaulted or gone through abuse, violence. So some of these environments sometimes can also cause mental illness.
Wow.
Yes.
Wow.
So that's
Or
death in the family.
you know, or sickness.
Yeah.
You know.
Okay.
If somebody is diagnosed with cancer, that can cause them to slip into depression.
Yes.
Okay.
You know, or even something simple as high blood pressure, because maybe they don't believe how could it be me? Why me? And that can cause them to slip into some type of imbalance, you know, state in their mind.
Wow.
You know, so I believe that stress and life-altering events, it's one of the biggest reasons why people go through mental illness or mental, you know, challenges.
Okay.
You
So
know.
typically, as a church, okay, you know, one time somebody asked me that, have I ever been depressed? And that this was my answer. Maybe it came and I didn't notice it. Fine, maybe because of my maturity, because of how I see things, because of how I see God and those things. So sometimes it's very hard, you know, when you see people going through those things and you don't know why. I mean, why should you? You understand? Why should you go through those things? You know, you know what to do, or pray, you know, trust God, you know, all those things. So normally it's like, why should you go through this thing? So sometimes it's a very thin line, how to help people, you know, when they are going through mental health, you know. So how can we, and with our African thing too, that we make it even worse. So how can we help if somebody have mental illness? What?
I want to say something about that. You know, sometimes, like you said, some of us may go through feelings of depression, and we may not even know. That is why we need, if you're a person, you should never be by yourself. And I believe that we spoke about this when
Yeah.
we talked about friendship.
Mm-hmm.
You should always have valuable people around you.
Okay.
Because sometimes you may not even know,
Mm-hmm.
but somebody around you
Will notice it.
will notice it and try to get you some help.
Mm-hmm.
Because sometimes when you're in that state, you don't even know what's happening to you. Many people don't even know the state that they're in, but it has to take somebody around them,
Okay.
you know. And sometimes we are church people, and we know all the verses in the Bible.
Mm-hmm.
You know, like for example, when we lost our mom, I knew everything in the Bible that talks about it,
Yeah.
but it hurt.
Yeah.
And I had just had a baby. My baby was 2 months old when my mom passed away. So it was devastating for me. I knew everything.
Yeah.
I mean, I would sit in the bed when I wake up in the morning with my baby, and they tell you, the African culture, they tell you, oh, don't cry.
Yeah.
If you cry, you're crying on the baby, and you're letting all your depression on the baby. So don't cry. But I really wanted to cry.
Yeah.
So I'll stay in the bed with my baby on my chest, and I'll just sob. I'll just go like this, and just sob and sob and sob and sob and sob. And for me, what helped me was because everybody will call you and tell you, oh, God knows best. God gives and takes away. Like all the verses in the Bible that you already know. But then you also have questions in your mind why this thing happened.
Yeah.
You know, that is causing you pain. And so this is what I told God. I said, God, I know everything
Okay.
in the Bible, but right now I need you to customize my healing. Whatever I need, you're
That's
the only one that knows it.
That's it. That's it.
And I need you to heal me. Show
Yeah.
me what to do to heal me.
Okay.
And I believe once I actually made that prayer, that was when I began to see things turn around. And what I learned from that is I think when we came back from Ghana after we buried her, I had a lady, and that lady is like in her 70s, came to the office. And when she came in, the complaint that she had was not really, I realized that that's not why she came. She had lost her mom, and then shortly after she lost her dad, and then shortly after she lost her best friend
Oh no.
in a span of like 3 months.
Oh wow.
And she was asking me, I want to talk to someone, you know, about it, because I all I do is cry all the time. I don't know what to do, and she's crying and everything else. And you know, so I had to get her help. And I also asked her if she had like a counseling department at her church where she can also get help. And she told me she was a counselor at the church. She said, I know everything in the Bible,
Oh my God.
but I'm hurting. And I told her the same thing I told God. I said, this is what I told God when I was going through what I was going through. I said, I told God, I said, God, I know everything, but I need you to customize my healing. I need you to open me up and see where it really hurts the most
Yeah.
and heal that. And that is what I told her. And I also sent her off to see a counselor or somebody that can help her. Because I didn't think that she needed medication.
Yeah.
I felt like if she went through therapy and counseling, she would be okay.
Yeah.
You know, so I believe that as people of God, or as people in ministry, we need to plant people that can help. If we can even send people in our church for mental health training, that would be great,
Yeah.
to help people when they are going through major life events.
Yeah.
You know, and just be vigilant. Just ask the Holy Spirit to help us to be vigilant when we see someone that's not looking themselves or acting different. Be able to pick it up
Yeah.
right away and try to get some help for them
Yeah.
before they slip off our hands.
Yeah,
Yeah.
that's very very important. I think that is really the key. You know, the key of, and also kind of open up.
Yeah.
You know, let people know is it's okay. It's okay to talk when you have, mental, illness. It's just okay.
Yeah.
Okay. It's okay to let somebody know. It's okay to let your pastor know. It's okay to let maybe a church sister know, your friends know. It's just okay,
Yeah.
to let them know, because I think the bottom line is seeking help.
Yeah.
And when you have people around you and you don't want to open up, and even sometimes they don't want to open up to receive the help. So you as a pastor, you will see what is going on, and you want to help them, and they will tell you they don't need help. But in life we all need help.
Yeah.
That's the bottom line. We all need help in a certain way of our life, and it's not shameful, to ask for help when you think you need help. I don't think it's anything shame here, to talk about. So let's do better, because it's just very interesting. It's just very. I think, was it like a month or 2 months ago that a youth pastor, that they said he was
committed suicide.
Yeah. And he was something. He was either a counselor or something.
Yeah, I think
I
saw that he was an advocate actually for depression and for suicide prevention.
Yes.
And he suffered from depression and
And I don't understand. I mean, I didn't understand that thing. And me, sometimes when I don't understand, I don't say anything. But I didn't really understand it. So it means that he was talking about it, but he himself
So
was
the bottom
suffering.
line is doctors need doctors.
Yeah, I think that's the thing.
Yeah.
Sometimes you yourself, your personality, you may think you're strong enough, but it doesn't mean that you can't ask for help. And it doesn't mean that you can't talk to anyone about it. We all need to talk about it and normalize it. That's the thing, making it normal to be able to talk about your emotions and how you're feeling. And I think maybe sometimes people may look up to people and say maybe you feel like maybe because I'm a pastor, I can't be depressed or I can't be sad. And therefore, if you don't have anyone to talk to and maybe you're getting everyone's problems, that can also become a burden too.
Okay.
So I think there can be a lot of factors in that, but just knowing that no matter who we are, we should be able to feel comfortable to have a counselor, talk to a counselor about it, get therapy, and sometimes also family therapy is helpful and needed to be able to discuss these things. But I think with also what Pastor Nana was saying, in cases where people have gone through loss, it's normal to grieve. That's normal. It's normal to be sad and maybe have feelings of being depressed. That's normal, but it's not normal to act on it. Meaning that and God has given us emotions, right? I can be angry, but you don't want to act on your anger, right? I'm not going to commit murder. It's normal for me to feel sad when I'm going through something or grieving, but not to take my life.
Yes.
So just knowing that these emotions that we have when something happens is normal maybe to worry, but not to the extreme that it takes over your life and you're debilitated and you can't do anything because you're worried so much.
You're hearing voices.
Yeah.
But some people do hear voices.
Yes, the voices aspect. That's
the schizophrenia.
Yeah.
Okay, the ones that hear voices.
Yes. They'll hear voices, something telling them to do something. And sometimes you hear the patient say, I hear that I need to pick up the knife and kill myself or cut myself. And there are people that will come and they have marks on them.
Yeah.
Wow.
And you ask them, and they're hurting themselves. They're hurting because they're hearing those voices. So if you're the type of person that hear those voices, you need to get help.
Yes.
Wow.
It's a chemical imbalance in the brain.
Okay.
And you need to get help so that you can, and like I said, you need to find someone that will be able to diagnose and find out why did you even get to that. Was it something you were doing the whole of your life, or it just happened the last month or two?
Okay.
What led to that?
Yeah.
What has happened in your life that has led for you to have fulfilled voices?
Okay.
Did you lose a close loved one?
Mm-hmm.
Did you lose your job?
Mm.
Did you find out some kind of news
Okay.
that has gotten you shattered
Okay.
and it's causing you to feel like you want to end your life as
Right.
well?
Yeah. Wow.
You know what I mean?
Yeah.
And so you would need someone like a counselor or a therapist to be able, a good one, not someone that's just going to shove you and say, you need, because even after you take the medication, you still need to be counseled.
Okay.
You know, if you went through a divorce, you need to be counseled
Mm-hmm.
to clear yourself so that you'll be able to start from a clean slate. If a woman has gone through a rape,
Mm-hmm.
she needs to go through therapy
Mm.
because all these things can show up
Wow.
at some point,
Point.
you know, and it may be bigger than how it started.
Yeah, if you don't deal with it early. Do you have any questions? Please, if you have any question, you can ask. Thank you so much for watching us. Thank you for joining us. I hope this one has been a blessing to you. You, please, if you need help, get help. I've also seen some people, sometimes they'll be on medication, you know, doing very well on the medication, and they think they are good. They stop, and the symptoms come back again. So in that case, what, did they have to be on medication the rest of their life, or?
Yeah, so,
Yeah.
so there are different degrees, different extremes of when we talk about mental illness. For example, in depression, there might be someone who therapy is enough because it's not as extreme. And someone who is very extreme where they do need medications to balance the chemicals.
Okay.
So there are different degrees to all of this that we're talking about when we talk about mental illness, different degrees. So there are people that long term do need medication to be stabilized, in addition to therapy, in addition to hormonal replacements and all of that. And then there's some people that therapy may just be enough, and they don't need medication to be stabilized. So, but yeah, there have been cases like in the emergency room where I work. I see a lot of people that come in with psychological, mental illness issues, and as Pastor Nana was saying, so usually even when someone comes in, whether they're depressed or they're hearing voices, we get blood work. We check blood work because sometimes it could be imbalances with blood. It can be a medical condition that can be causing this.
Okay.
So we first check blood work to make sure that it's not a medical condition that can be causing them to have this.
Fever can cause somebody to
Yeah,
have.
or even if they're taking drugs, if they're on cocaine or anything, that can cause things that can make you think that they're having schizophrenia or bipolar, but it could be because they're on drugs that are causing these things.
Okay.
So we do that, and then but we also speak with them and make sure just to learn about what happened in their past. Did they go through any sort of trauma? Were they abused? You know, so we discuss those things too, because as we said, it's multifactorial as a lot of things that can cause this. So it could be chemical imbalances, medical issues, and we talk to them too, and also we get the psychiatrist involved and setting up therapy. And then depending on how severe their case is, some get started on medication. as
Wow.
well.
Wow. Pastor Nat, do you have anything to add on? I can't believe our time is already up. So do you have anything to add on to? In conclusion, what do we do? Personally, I think we just need to ask for help if you need help. If you think, you know, you are not thinking right, you are not behaving right, and people, at the end of the day, people love you. Nobody will tell you, why are you behaving wrong when you are behaving right? You know, but people have a way of saying, I'm okay, there's nothing wrong with me, and sometimes make it very hard. You know, so in conclusion, what do you want to tell the viewers about mental health? You know,
Mental illness or mental challenges, it's real. It is a real problem, and it is something that we should not be ashamed of.
okay.
It is something that we should talk about. it is something that needs to be dealt with, because like you said, that God desires that we are healthy in every part of our body,
Yeah.
in our mind, because when the mind is sick, the whole body is sick,
The whole body.
you know, and he desires for us to be whole. And so it's important that if we're hearing any voices, if even not us, our family member, our child is going through something,
Yeah.
we should be able to look for help for them.
Yeah.
You know, talk to your pastor, find a counselor that is good, find a doctor that is good that can run all the tests to find out what is happening, so that you or your family member can get the best help.
Yeah. Yeah. That is very important. No?
Yes, so I agree with everything that was said, and just knowing that, yes, mental illness, as she was saying, is real, and there's a lot of factors that can cause it. So we should just be more, to recognize these things, whether it's our family members, our friends, and not to shame anybody that may be going through any of these things, but instead to encourage them to get help. And for anyone, if anyone is thinking or anything like that, I wanted to give the suicide prevention hotline number.
Yes.
Okay.
Yeah,
So if you're having any thoughts of wanting to harm yourself, or if you may know anyone that's having any suicidal thoughts, just to reach out and call 1-800-273-8255. Again, the number is 1-800-273-8255, and that's the suicide prevention hotline number.
Yes. So please, do we have any more questions? Do we have any more questions?
No questions.
No question.
No.
So as much as is this thing is very, very important, because it's just too sad, how people are committing the suicide. The suicide rate is just amazing now. It's just amazing, and I think that we can do something about it. And the only thing we can do is, please, let's see mental illness, mental health as part of anything that we do. As when you have headache, you reach out to take Tylenol, or when you are having gastro, you want to go and see your gastro doctor and all those things. It's the same as that. So please, don't be ashamed when you are having problems up here. It's the same as having problems in your stomach. So please, let's take care of ourselves. And as doctor gave the number, if you are having any thought, please call and seek help. It's better to seek help than to do things that I think it's better to do that. So thank you so much. And please continue to reach out, to somebody. If you know somebody that is having been withdrawn and they are behaving a little bit abnormal, reach out to them. Let them know your arms are open. Help them in any way that you can help them. Because sometimes I think people also feel ashamed that, how are people going to see me once they know that I'm having issue here? But I don't think that's what we want to portray. We are one another keeper, and we will try to be good friends. So check up on your friends, your neighbors, check up on your church sister, everybody, and make sure that everybody is okay. And above all, I personally think that when Jesus says that he took our disease and sicknesses, I personally think that he did. So if Jesus have taken it, you cannot have it. So read the Bible, pray, apply what the Bible says. Don't just read the Bible like a newspaper. When you read the Bible, walk it, talk it. So whatever Jesus have done for you, proclaim it, and trust God for a wonderful life and a wonderful healing, that we will not have all this suicide here back and forth. And I'm just praying that all of us will have a very clean and a wonderful mind. The Bible says that we have the mind of Christ. Yes, if we have the mind of Christ cannot be sick. The mind of Christ cannot be depressed. So let's trust God. Hold on deep into the Bible. And let's trust God for a wonderful mental health. Thank you so much for joining me. Please continue to share the video. Tag your friends to come in. And I will see you back here next week, the same time. We're going back to talk about fitness next week. And I think it will help you. So go out and be the wonderful man and woman of influence God has called you to be. Thank you so much. God bless you.